My name is Sandy Valentine, and I am the Executive Director of the Rhode Island Community for Addiction Recovery Efforts, which is fondly known as RICARES. And we are really excited to see so many folks in the room tonight. There's been quite a few addiction and recovery professionals that have gathered together for this evening. And you can see our brands on the banner behind us, but this is a great example of what makes a difference about working in recovery, is that we work together, we work across organizations, we work across roles, and I think that's what we're looking for in terms of what we want to hear from our candidates tonight, is how we can work together. So I am a person in long-term recovery, and for me that means that I became substance-free in September of 1991 when I was 26 years old. And when I was 26, I had a moment of readiness. And in that moment, I was ready to take my life or start a pathway of recovery. And when I was ready, when I was making that decision, I had a person in my life that I could reach out to who was ready to receive that call. And she said, what you need to do, because my statement to her was, I'm in jeopardy. And I didn't elaborate, but she knew me. And she said, you need to go to a meeting. And fortunately, there was a meeting in 20 minutes, a quarter mile from where I was living. And when I got to that room, those folks in that room were ready for me, ready to help me and get my pathway of recovery started. Well, mine is a pretty simple story. I was young, not a lot had happened. Some people would refer to me as a high-bottom drunk, which has nothing to do with my posterior, but had to do that I didn't lose a lot of things yet. And for most of the folks that we're working with on a daily basis, it's not as simple. They're navigating system challenges that are beyond the ability of one simple phone call to solve. And many of us were in DC recently and got to hear firsthand from VICTA, and he really challenged us all to become a recovery-ready nation. And to become a recovery-ready nation, we need to become a recovery-ready Rhode Island. And so when we think about what that readiness means, it means that we need leaders, we need candidates like the ones who have come to hear from us tonight. We need people elected into position. We need people across all types of roles to be ready when the individual places the call, to be ready as a system, that we don't get kicked out of the services. And, you know, just to share a recent example that we've experienced, we had an individual who was on his pathway of recovery, living in a recovery house, and he returned to use, got kicked out of his recovery house, was told you have to go to detox for 3 days, couldn't go to detox because he hadn't used substances for 5 days. And so he ended up homeless with choices to make about returning to use. And these are all things that are impacted by policy and impacted by our political leaders. So we're grateful that you came to share your questions, to look into our candidates, to see who might help us become recovery ready. And I'm going to hand things off now to Lisa Peterson, who's going to introduce our guests and get us started. Thank you.
Thank you, Sandy. We're glad you're here with us. I was just going to suggest that. I appreciate that folks were able to get here. I understand there's some congestion out there, so we will just roll with the punches, which is literally what we do every day in this field. So I'd like to introduce the candidates who are here. We have Mr. Gabe Amo, we have Councilman John Gonfalves from Providence, we have Lieutenant Governor Sabina Matos, and Senator Anna Quezada. So we're really glad that you could be here with us, and we're going to start with just some sort of general, high-level policy questions, and really just interested in what you would do in this role, or how you would support our communities in these roles if you are elected to represent the great state of Rhode Island. So thank you. Yes, there are a couple of mics up there, so we can just share, and I will start in alphabetical order, and then we'll go backwards on the next one. So in 2022, we lost 434 Rhode Islanders to the drug poisoning crisis, just one life fewer than a tragically record-setting 2021. There's ample research supporting a wide range of harm reduction interventions, yet some of these life-saving tools are either barred from federal funding or barred from operating in the U.S. What policies would you propose or support to help reduce preventable overdose deaths? And we'll start with Mr. Amo.
Thank you so much for the question, but first I want to thank everybody for being here on a summer evening. There are a lot of places you could be, but your commitment both to the communities that have organized this forum, but communities across the state broadly, is something that you should be acknowledged for. What I would say is, I think in terms of strategies, we need to embrace what research suggests works in terms of harm reduction. People with substance use disorders, generally speaking, are not going to be served by one-size-fits-all strategies. And so you see a lot, especially at the federal level, a mix of jurisdictional responses where, you know, in New York City, you don't have a U.S. attorney who is vigorously, you know, pursuing Mayor Adams and his administration, and you have other jurisdictions that may be pursuing strategies that are being called to question by their U.S. attorneys. And so I think that inconsistency is a challenge to the community long term. And what I think we need at the federal level is a broader embrace of a consistent strategy, deploying the research capacities that we have, as well as the great leadership we have at agencies like SAMHSA. I know we have Tom Coderre, a Rhode Islander, who has been in long-term recovery, serving in a leadership capacity there. I want to defer to experts rather than have politics drive the narrative. Additionally, I think that we've seen a large amount of new federal resources through Medicaid expansion, through the bipartisan Safer Communities Act. And I'll finish the sentence here. We've seen those resources. Now what we need to do is greater collaboration with the community to make sure that they're deployed effectively.
And I apologize, I did not introduce our timekeeper, Rana Cabral. When we thought we had 9 candidates, I was a lot more concerned about it, but given that you 4 are here, you have the floor. Councilman.
Great. Well, thank you so much for holding this forum, and thank you all for being here and for being engaged in this process. It's critically important that people are involved. My name is John Gonsalves. I'm a 2-term city councilman representing the east side and downtown in the city of Providence. Downtown, as many of you know, is one of the largest overdose hotspots in the state. And so this issue is very personal to me. I see it on the ground every single day. And there's a lot that we need to do, particularly locally at the state level, but also at the federal level, to address and mitigate some of the challenges that we're experiencing. So one of the things that I hear often from folks is about Medicare reimbursement rates. It's a huge issue that we need to address wholeheartedly on the ground. And I really want to thank the advocates who every single day, day in and day out, many of them who are in this room, Haley McKee, you know, Anna Jane, Weber Renew, East Bay Recovery Center. There's so many people who are passionate about these issues and who are addressing these issues every single day. You know, I was just looking at the stats recently because I get them. There were over 40 overdoses this week, over 20 in the city of Providence. And we need real solutions to address this. And one of the overarching root causes is our housing and housing affordability issue that we're experiencing. There are so many people who are down and out and on their last leg, and they don't have the resources. And it is incumbent on us to humanize those stories, those experiences, the challenges that people are going through, and make sure that we're providing every single resource at our disposal to take care of the people in our communities. It's why I've pushed, and I'm very, very proud of my record on this, for our police officers and our public responders to carry naloxone so that they're addressing these issues on the ground. I think at the federal level, we have to look at the Model Syringe Services Program Act, which is a broad way to address these issues. on a daily basis all across this country. But overall, I just want to say that we need to humanize the experiences of people who are going through mental health challenges, people who are utilizing opioids, or people who are struggling from substance abuse, so that way we can make sure that they are getting everything that they deserve, because they truly deserve it. So thank you so much for being a part of this discussion, and certainly looking forward to touching base with all of you tonight.
Councilman, Lieutenant Governor.
Thank you. Good afternoon. Thank you for this opportunity to speak to all of you, and most importantly, thank you for the work that you do. Through my work, first of all, at the local level in the Providence City Council, I had the opportunity to work with many of you that have been doing the work, the hard work, like the project Weber Renew since the beginning when they started, in being able to support the work that they have been doing, and also being able to assist the best I can from first of all in the City Council, and now as Lieutenant Governor. I go back to housing. Every problem that we have, unfortunately, you can trace it back to housing. You just described right now how there were these individuals that were in recovery, but then the policies that we have in place don't allow for them to have a place to live. And this is something that we have to address, and we have to address it at the federal level. I have been mentioning this before. I just heard the connection with the same stories that I had to witness myself, trying to help families find a home, a place to live. In these policies that are basically regulations that HUD has for the definition of homelessness, is stopping us from being able to have resources available at the local level to assist families. When you have a policy that tells you that if someone is staying in a hotel for a night or a few days, they're not a priority because they have a place to sleep at night. That is wrong. That has to be changed. Unless we change those policies, we're going to continue to see this happening over and over again. I just was reading the article in the paper, I believe it was over the weekend, talking about some individuals that unfortunately right now are homeless. And they were telling about their story about most of them have been individuals that have been dealing with substance use and have been struggling to find a home because of that. And I think that we have to make sure that we address the housing situation, and we provide a relief for those that are facing homelessness before we are in crisis. Thank you.
Thank you, Senator.
Well, good afternoon, and thank you for having me here. It's great to see so many people this afternoon. My name is Ana Quesada. I represent District 2, and you are my district, working for my neighborhood. But one of the things is many issues, and housing is one of them. But we have many issues that we have to solve. Make sure people have insurance. Make sure mental health issues be taken care of. Making sure people have a bed when they have a crisis. And how we can do this, there's many ways. We can do it at a local level. I'm the only one who talk about this in my west side. Nobody else, or the people running for this seat, are talking about substance use, mass cancellation. I'm the one who, from day one, I've been talking about this because this is a crisis. More people die of overuse than gun violence, than car accidents, than fire, and many things, putting it together. And that's amazing to see, but nobody talking about this issue. You know, and I've been a champion at the state level, working on those issues from day one. You know, I pass many legislation. I pass a legislation that now people who will translate can have 3 days to advocate for them, to make sure when they come out from jail, they have a place together for them. They have housing for them. They had a program together for mental health issues. They have a program for them if they're overusing or if they have mental health issues. Then this is a situation they have because the 48 hours before somebody get out of jail is value, is so important because that's when they can go back in. But see, we put together resources together for them to provide the support that they need in the communities. And when we talk about housing, definitely, housing is an issue. But we cannot just put somebody in housing right away. We have to provide the resources that they need before they be ready to be in housing. We need to make sure that they get the help through the mental health issue they have it. I'm a social worker. I've been working on this issue for many, many years. And like I said, it's something I've been working at the state level, something I will do when I get to Washington, and I make sure that our communities get the resources they need to buy more beds available when somebody having a crisis, to make sure people have Medicaid for all, that everybody had an insurance to be provide the service that they need, and to make sure that we will do whatever we can to prevent. I believe in preventing, educating parents, educating children at a very young age that this is not the way to go. We need to prevent before we do anything. Thank you.
Thank you, Senator. We're going to stay with you. Go in reverse order. Rhode Island is experiencing a critical shortage in the behavioral health care workforce at the same time that community need is surging. Starting salaries in many organizations rank below retail and fast food establishments and are insufficient to meet workers' basic needs, much less their student loans. This crisis is driven in part by stagnant reimbursement rates and a lack of healthcare parity enforcement. How can we address this urgent need at the national level so our state can rebuild its crumbling workforce infrastructure?
Well, it's many ways to do that. And one of them, I was the one who raised minimum wage in Rhode Island to $15 an hour. And that's something that I would work at the federal level to make sure that, because if people get paid the right way, you will find workers. When we raised the minimum wage, I had many people criticizing because we did it during the pandemic. And they were like, how did you able to put the minimum wage after we went through the pandemic? And then now they realized that that was needed to do because people wasn't finding workers. People didn't want to go back to work after the pandemic because they wasn't getting paid enough. You know, and since I've been in the Senate, this is one of my priorities, to make sure we fight for staffer, to make sure people and nursing assistants get paid the right way, to make sure people get paid. So far, we did it under 21 to raise the minimum wage. In every year, somebody get $1. Then there's many things that we need to get to make sure we get workers in the state, but workers get paid to be able to have a living, to be able to pay for housing. Housing is so expensive today. You know, it's so many things that we need to work together, and I think we can do it. And I would definitely work in Washington to make sure that workers get the right pay, but they get benefits and they get vacation and everything they need to be able to go back to many people to go back to work.
Thank you, Senator. Lieutenant Governor.
Thank you. Definitely we need to increase the reimbursement rate, and I have been vocal. I have sent letters of support for the legislation introduced by Senator DePalma and also by Rep. Casimiro. But also we have to do other things, like just last week I went to a graduation for a class of CNA workers with an emphasis on mental health. So we need to provide support and resources for more programs like that in order to help us meet the demand of the challenges that we have right now for the need of workers. But definitely, we have to make sure that we're paying a salary that is compatible with the skills that they provide. And when you have right now, as you mentioned, fast food restaurant paying more than what they make as a CNA, you cannot blame someone for trying to better the incomes of their family. So we just have to make sure that we provide a better wages for those working in the field.
you, Councilman.
Thank you. Thank you for this question. I think it's so important that you ask this question. And I just want to start off by, and this is no affront to the other candidates, but the fact that we are the only 4 people here, I think is really a slap in the face to this community. This should be a priority for every single candidate out there, and the fact that they are not here, I just find that very problematic. We had a number of things on our schedule today, and we made it a priority to get here. You know, there's a library in my community that we help fund to get back into order. It's a library that helps so many people in our community, and we've got, you know, we're reopening the library for the folks who utilize that today, but we decided that we're not going to be there so we could be here, because this is a very, very important conversation and discussion that we should be having. So I just want to say it's an unfortunate shame on the rest of the candidates who should have been here to be a part of this discussion, and the fact that they're not here, I just want to, again, affirm and thank the people who did show up, because we really should be having this conversation. To the points that were made, I think we need to do everything in our power to make sure that we are increasing reimbursement rates, but we're also getting people in the field and excited about these fields so that they can participate, particularly our young people. Because what we're seeing, particularly in this industry, is there's so much turnover, and there are people who have been in the field for quite some time. But in order to address this issue, we need the kind of workforce to facilitate and address some of the challenges that we're experiencing. But I'll pass it off to my colleague here so he can elaborate. But again, I just want to affirm everyone who's here, and it's a shame that more candidates can be here today.
Thank you, Councilman.
Thank you. I agree with previous comments on reimbursement rates. I think it's a challenge system-wide. We see it, and so I think, you know, there's no need for me to elaborate further there. But I would say, to the extent that we can, at the federal level, have some broader funding that pushes down through the system, that will make a critical difference. The next bit I would speak to is mental health parity work that is sort of unfinished business of the Affordable Care Act way back in 2010 in the Obama administration. You see, just recently, in fact, just last week, one of the bigger champions for mental health parity, former Congressman Patrick Kennedy, was present as the Biden-Harris administration moved forward on finalizing a rule to ensure that we actually achieve that. The next bit I'd speak to is the workforce challenge. I think this is something we see in a lot of critical fields that are for critical roles that we have in our communities, whether we see it in our teaching workforce. It extends to so much of our healthcare workforce, and you see the concentration of people actually being able to receive services being limited to those who have the means for private practice, and that is something that we need to make sure to continue to build a pipeline. We need to make Rhode Island attractive for people who do have options to work in this space to be here. It ties to the points made earlier on housing that the Lieutenant Governor and the Senator made. I think it all fits together as part of the system, but ultimately our fundamental priority has to be to make sure that everybody has the care that they need.
Thank you. We'll mix it up and start in the middle with Councilman Gonzalez. Over the past decade, there has been progress in the way that we understand and talk about substance use disorders. including recognition that this is a public health issue. Our policies and systems, however, continue to perpetuate stigma, resulting in continuing harm. Where would you begin to help the U.S. walk the walk of ending the fear, bias, and discrimination towards people with substance use disorders?
That's a very good question. I think it starts with education, because the stigma that we're experiencing in the wider community is totally unfounded. And it's also the stigma that we experience around harm reduction centers. If you look at what's happening internationally, harm reduction is something that has been very successful all across the world. And for decades, I mean, there's clear research on the effectiveness of harm reduction centers. And I'm proud, at least in my role as chair of state legislative affairs on the Providence City Council, to have put a lot of bottom-up pressure on the General Assembly to actually pass the bill to make sure that we have harm reduction centers in our state. And that was passed in 2021. Now, the problem is, we're not, as a state, and I won't say myself, but I think broadly, we're not putting our money where our mouth is. It has been 2 years since that law was signed, and there are all these barriers in local communities in terms of the implementation of harm reduction centers. You know, I've been a fierce advocate for trying to get harm reduction centers via our local zoning laws in downtown Providence. And the thing that is really frustrating for me is the powers that be. Unfortunately, there are people out there who have a lot of power and money and influence, and they become some of the biggest barriers to providing people with the care and the necessary resources that they need in order to succeed. And I think we need to address that wholeheartedly. And as your next Congressperson, rest assured we are going to fight back, especially with these deeply rooted special interests that don't want to put people first. They're worried about their own bottom lines or how it's going to affect Kennedy Plaza or their businesses, but they're not willing to address the underlying root challenges that we're experiencing in our society, and I think that is a shame.
Lieutenant Governor.
Thank you. I think part of the things that's going to help to remove the stigma is to highlight more of the members of the community that have been in recovery for a long time, and that can be a good example for others others that wants to take the journey of getting into recovery, to see that it's possible, but also to educate the rest of the population, the community at large, to let us know that to remove the stigma, we can see individuals that have been able to be in recovery for many years and being successful, and we need to be able to share those stories also. So it's a little bit of communication with the general public, communication with the elected officials to educate us about the struggles that the community goes through, but also that we have to be at the forefront, speaking out and in acknowledging that the individuals in recovery are contributing to our community and are valuable members of our society.
Thank you. Is stigma, and especially I'm talking about because this community, especially community of color, they look at it like it's a disease, and I think we need to educate people about it. And to educate people to see that because you have an overuse thing, that is not about people. Anybody can go through this. That can happen no matter what education you have, no matter what color you are, no matter who you are, who you know, how connected you are. That can happen to anybody. And see, we started seeing it that way. And I said that because many years ago, when the marijuana was using in the 70s and the 80s, many people of color got incarcerated because of this. Then we started changing that when children from Brown University were getting in trouble. Then we started saying, well, marijuana is not a big deal. Let's change the law to help them. And now we see this problem going through richest communities, and now we are doing something about it because it's going through the community who are connected, who are wealthy, and they know it's an issue. But when it was people of color that this was happening, people wasn't doing anything. Then that's where the stigma comes from. You know, to think that that only happened to poor people, to people who live in poor neighborhood, but now we see that change. That can happen to no matter where you live, no matter who you are, no matter if you had a master or doctor degree, no matter the education that you have, that can happen to anybody. And I think that's going to help us to change the stigma on overdose and overuse. Then I think this is something that has to be with education, teaching children, teaching the community. If somebody because somebody hasn't been had, does not mean that person is bad, does not mean that person is a criminal, and we need to change that stigma, but we all need to do it together.
Thank you. Mr. Amo?
Thank you. I think the remarks you heard from my fellow candidates were illuminating, and I think I agree with them for the most part. For me, it's about proximity. Right? This isn't an other. I think we are all sort of in this together. I've worked at the heights of government in Washington and in Rhode Island, and in those senior staff roles, I've worked with people who are in long-term recovery from substance use disorder. And so I've experienced it through highly capable, amazing people. And so what I would say is that you know, the challenges that we face, I think about it, and for me culturally, my parents are two immigrants from West Africa, for them to sort of come to terms with family members required some education, some real learnings across the way, but once they were proximate and felt that this was not a problem that what was limited to a certain subset of the population, but that we have folks in our community around us all the time who are in recovery, and taking that approach, an approach of proximity, and it being something that, you know, stigmatization is not going to solve, I think makes a huge difference. And you know, when I think about what we need to do from a public health standpoint, one of the first things that you do in the public health context is you try to establish the frequency and know that there are people among us who are part of said populations, and you know, don't isolate. You actually sort of get closer and learn more and dive deeper. So that's what I would hope that we're able to pursue in order to make sure that we reduce stigma for folks in recovery.
Thank you all. We have a little bit of time left, and I know that you have another commitment, and we appreciate you stopping in. So I wanted to start the Q&A a little bit early so that you have the opportunity to hear from the community, and you all absolutely are also welcome to participate. We have a candidate who will be joining us in place. So you'll be leaving after the 5 to 6. We will have a 6 to 7. We'll hear a little bit more from another candidate. But let me invite some of our community members to ask questions, clarify, hone in on points that maybe were not clear.
I actually have a question. I hear a lot about, you have some information about addiction and all that stuff. I am a person in long-term recovery. I'm also drug diagnosed. And very little I hear about both together, because they both go together. And I also have a big concern, where is the Latino community or the minorities being represented? Because I see other communities getting the support, but we don't. I have been to the trenches and I had to figure things out on my own. Stigma is a big issue, not only in the community, but also in the medical, also even in the behavioral health field. Nurses treat us like garbage. Doctors talk down to us. Social workers, like, they tired of us. They think that we are never gonna get better. Pretty much they're giving up on us. And I don't understand, like somebody said here, we are humans, just like everybody else. But remember, we also vote. We also vote. And I think that needs to be taken into consideration. I would like my community to be represented, because they're very little out there in my community. Nobody, I was talking to this lady, right? She has an issue with her daughter who has substance abuse, 18 years old. Mom is probably 45, Latina. She knows nothing about this stuff, not a thing. And over and over and over again, I see that. And I think that in order for certain communities to get the information and the support, somebody in power should be able to get that to them. You know, because we too. Thank you.
Hi, Pat Ford, Coalition Radio Network. Mr. Richard Cowan coined the phrase the iron law prohibition. That states as law enforcement becomes more intense, the potency of prohibited substances increases. It's also said that legal drugs are safe drugs. As a member of Congress, will you support the legalization of all drug narcotics?
I didn't hear your question. Sorry, Pat. Would you repeat?
Sure. Okay, I'll repeat
The question.
And since Senator Tanner's got here, we'll ask you first.
Mr. Richard Cowan coined the iron law of prohibition. As law enforcement becomes more intense, the potency of prohibited substances decreases. Many would argue that this is one of the underlying causes of the presence of fentanyl. It's also said that legal drugs are safe drugs. If elected to the United States Congress, will you support the legalization of all drugs?
Yes.
Good afternoon, everyone, and I apologize not being able to be here earlier, but my name is Sandra Cano, and I'm happy to attend this forum, and thank you so much for putting it together. I think the question is, if elected to Congress, I will be in favor of legalizing all type of drugs.
From the heroin to the cannabis.
So I have been, as a state legislator, very supportive of the cannabis legislation or legalization of marijuana, and I think that I will do the same thing at the federal level. I think that I work very hard with my colleagues in the General Assembly to make sure that we not only support the legalization, but also that we protect the communities of color for decriminalizing the people that have been already punished for the crimes in the past or making a crime in the past, and I want to make sure that at the federal level we do the same thing. I think that our communities of colors are very disproportionately affected by this issue. I think for the other drugs, I would have to do some research. I believe that it's important that I understand the impact, not only for the community, but also, for the country. As I don't know if there is any other countries that have done and legalized any other drugs. So I will be very honest. I love to do some research, learn more about it. But as of the marijuana or cannabis, definitely I will be supportive at the federal level.
I too support the decriminalization of natural drugs like marijuana. I think there needs to be more work done on synthetic drugs. There's a clear difference between synthetic and natural drugs, and we certainly want to think about the impacts that certain drugs have on our community. But decriminalization is an important aspect of that. We do not need to be putting people behind bars for the use of marijuana. And there have been so many people who unfortunately have been locked up as a result of their use of marijuana, which then just perpetuates their inability to have access to jobs or have access to housing, and we need to address that head on. So I appreciate that question, but there does need to be some nuance around that.
I do support the legalization of cannabis. I'm not ready to support legalization on any other drugs beyond that. But one thing that I do support is to make sure that those that use other drugs are not being sent to prison for because they're using other type of drugs. Instead, that they're sent to programs and rehab programs instead of prison. But what I support right now is the legalization of cannabis.
Well, many countries in Europe, the drugs are legal. They are legal for people to use any kind of drug. And even a place like Portugal, there's a very, how would you say that, you know, a big country like United States, and I think Portugal is a place the people are very conservative. That's what the word I was looking for. They discriminate. Anybody can use any kind of drug. But I think we have to be more informed about what kind. I think the war on drugs needs to end, and this is a way to do it. But at the same time, I think we need to educate people about it. You know, because we don't have that much information yet. I don't know if there's any law in Washington at this time to propose to have the drug abuse. But, you know, I think we need to educate ourselves a lot better before we make that decision. But I know it's many countries in Europe that you can use any kind of drug already. And I think they're having less issues and they have less people overdose or drug in the United States when it's illegal. I think when it's illegal, how we call it, sometimes call more attention to people to use something when it's illegal than when it's people are able to do it. Then I think we need to finish the war on drugs, and maybe the way to do it is to make sure that anybody can use any kind of drug, and then we can see it. Because if you see Portugal and many other countries, they don't have the problem the United States have at this time. It's a lot less than us. Then whatever we're doing is not working. Then we need to see what other places they're doing and how they're doing for us to copy them, and maybe it's better for us that everybody's legal to use any kind of drug, but supervise them to make sure they have the resources they need to be able to do that. Supervise it, like the new program that we just started in Rhode Island, that you can go in there and do drug safety. Somebody would be there in case you had an overdose. Then I think that would be the way to go.
Lisa, can I just elaborate
Absolutely.
for 1 second? Just a couple seconds here. I think the other thing that we really need to be thinking about is how we hold the pharmaceutical industry accountable. I just can't get how a society, how we, you know, if you think about the war on drugs, there are black and brown communities that are disproportionately impacted by the war on drugs, but there is little accountability for the pharmaceutical industry. And the pharmaceutical industry in many cases is more of sometimes a sick care industry as opposed to a healthcare industry. And when we think about public health, and when we think about the wraparound services that people need and the mental health challenges that we need to address as a society, we need to look at this more broadly and address it holistically.
Thank you. Lieutenant Governor, and then Senator Cano, and then I'd like to give Mr. Carson
I
an opportunity.
actually want to address her comments, so if the senator has a point related to this, I just don't want to ignore your comments. I want to be able to address that so I can go out.
Oh, sure. I wanted to add one more thing, that I think that when we said that we support at the federal level the legalization of cannabis, we want to make sure that as a country, the profits that that bring really are reinvested in the community, just like we've been doing in the state of Rhode Island. We could do better, but we've been doing some investments in harm reduction centers, but also in mental health and also any type of support to make sure that not only we empower the communities, and most of the communities that are disproportionately affected by this criminalization of you know, the crimes that we will talk about, but also we want to make sure that we have a safe place, just like Senator Quesada said, for users to be able to feel okay, just like the harm reduction centers that we do have in Rhode Island. So investments need to come back to the states, and I think that we need to prioritize that when we do legislation, and make sure that we are very proactive about making sure that those investments come back to the communities that needs it.
Thank you, Senator. Mr. Carlson, the question on the floor is, in short, would you support the full legalization of all drugs across the continuum?
No. No, I would support the legalization of cannabis. Legalization really to regulate cannabis, because I think there are studies that show that there can be harmful effects on teenagers in particular, on adolescent minds. And I think it's really important that we try to make sure that we regulate the levels of THC. You know, they're dangerously high in some corporate-sponsored cannabis products. And I hear, you know, this is something that I've been pushed on a little bit by some friends who've had some issues to do a lot of research. And there does seem to be a growing amount of evidence that the nature of cannabis is changing over the course of time, and it's becoming more dangerous, mostly driven by corporate profits. You know, this is a big company kind of game, right? A marketing spend where you push it harder and harder, you get the THC higher and higher, so people get more of a rush out of the drug, and then it really does need to be regulated so that it doesn't get in the hands of adolescents. So I think on that front, I would say legalization should regulate. There are some drugs I think that never should have been made illegal, and I think typically those would fall into the hallucinogen category. A lot of those were made illegal in the 1970s in order to criminalize conduct, to put people in jail on purpose, people of color, people that believe in the anti-war movement. And Michael Pollan did a wonderful job of describing some of those nefarious motives for illegalization in the 70s. Believe it or not, some of these drugs weren't illegal when I was a little boy, which shocked me when I read that in that book. I thought they had been illegal since the dawn of time. That's just not true. I'm proud to say that I actually wrote the very first check to start the Yale Center for Psychedelic Science, which is a group of really well-organized, gifted psychiatrists and psychologists that are working hard to look at the power of drugs like psilocybin in particular at Yale to combat depression and afflictions of anxiety. And it's a very personal issue for me because I have a child who's afflicted very severely with OCD. And some of the studies at Yale are showing tremendous promise in helping people with OCD and helping them to get better and helping them to not get rid of their obsessive thoughts, but get rid of the compulsions and the disorders that make their life so limited. And a part of the disease that's really debilitating and makes it a disorder. So I would say not all drugs, but I think with thoughtful scientific research, some drugs for their therapeutic effects should never have been criminalized in the first place. Thank you.
Next question.
Hello? How is criminalizing people in our community for fentanyl helping? And this seems to be health-related, not criminal-related. And what actions are you going to take to change this?
How is criminalizing people in our community for fentanyl helping when this seems to be health-related, not criminal? And what actions are you going to take to change this?
Is there any order you want us to go in? Sure.
So I think it goes back to the question that we just answered, which is the difference between synthetic drugs and natural drugs. You heard one of my colleagues on this stage talk about the fact that there are natural drugs, and whether you think about mushrooms or psychedelics, that can actually address some of the mental health challenges that people are facing, and decriminalization is a start. But it also goes back to holding the pharmaceutical companies accountable. There should be no reason, again, why they get slaps on the wrist for dishing out all this fentanyl in our communities and providing our communities with opioids and not suffering the consequences for it. Because let's be frank, if it was a person of color who was distributing fentanyl on the streets, we all know what the outcome would be. And so it's a real equity issue. And if we're going to be completely honest, we need to make sure that we're holding the pharmaceutical companies accountable, because they are complicit in this problem, and there are so many people who have loved ones who have died as a result of their abdication of responsibility. And that needs to be taken very, very seriously. Thank you for that question.
Similar to what I said earlier, and so right now I'm in support of supporting cannabis to be legalized at the federal level. I'm not ready to say that I will support the legalization of fentanyl, but what I do want to see is that those that are using fentanyl most of the time just to become addicted based on some medical treatment in many instances, that they are treated that way. That someone that is, as you just said, it's a medical issue. It's not an addiction that should be looked down on those individuals. It should be treated as the problem that it is, which is a medical condition.
Well, before I continue, I want to answer her question, or not her question really. She just made a comment about the Latino community. One of the issues with the Latino community, I think, is the language barrier. Many times it's very hard for a Latino to find counselors managed, to find any program directly to the Latino community. And I think that's go back to, we need to teach our children to go for, psychology, to become, we have a few Latino doctors in Rhode Island, but not enough. And I think that's the biggest problems. I get a lot of moms calling me and saying, my son is using drugs and I don't know where to take them. And sometimes many of the Latinos go back to their country because they think they can get better treatment than here. And it's not because the treatment is better over there, but because they can speak to the doctor in their own language. And the doctor can understand what the issue is. But when you don't speak the language, it's very hard for you to find the resources or to find a program that your children can go to. And then when the parents don't speak the language, it's hard for them to be able to help their children. Then I think it's more a language issue than anything else. It's just that we need to find more doctors. But one of the things, I remember a few years ago, we passed the Crystal Law in the State House. And it was a law that I was against it from the beginning, and I voted no. Why? It is not because I agree with people selling drugs to anybody, but I think we all have to take, the reason I voted no on that thing, because I knew that was affecting people of color. It wasn't, that law wasn't for nobody else than people of color. So you sell drugs to anybody and that person dies, you get in prison for life without, And I think it wasn't fair to do that because sometimes people are selling this and they don't even know what they're selling. And I think we need to look into it and, to be fair to people, because I remember when that law, one of my senators, Senator Gallo, got upset with me for like months because I voted against it. I looked for other senators to vote against it because I think it wasn't the way to do it. Finish the war on drug is the way to go. We need to not look at people because they have a substance abuse to look at them like criminals. And that is the issue. They're not criminal. They had a health issue. And we need to look for help. We need to find a solution, not to criminalize them, send them to jail. Because sometimes they have minor drug on them, and maybe it's something that they're using. One of the reasons at the beginning I was against the marijuana bill. And then when I teach myself and educate myself, I think it was the right things to do. But one of the things that I like about the drug, it was that now people can expunge the record automatically to people who went to jail just for marijuana. And I think the community of color paid a very high price in the past, but not the community who benefits today of selling marijuana. It's very not that many in our community who qualify to have one of those places where you sell marijuana. But we were the one who paid the price in the 70s and the 80s. Thank you.
I'm sorry, I was going to address her comment and then got into the next question. So that's when I go back.
Yeah, you want to go back here and then we'll go to her comment.
Thank you. So I appreciate your comment, and it's true. What you're saying is right. And I can tell you because when I was in the Providence City Council, I was struggling trying to find resources and information in the community. When Colleen came to the neighborhood with Project Renew, before it was Weber Renew, it was like a blessing to me because they were able to provide resources and information that we didn't have. Within the Latino community, unfortunately, there is a lot of misunderstanding about the challenges that individuals that are using a substance, what they're going through in the resources that are available. And the main reason why I'm here in this forum today is because I want to learn from all of you. So I'm looking forward to continue this conversation and learning from you what ideas you have on ways in which we can address and do better. Because I agree, we have to do better. Thanks.
I just wanted to answer your question by saying that I think it's our responsibility from policymakers to really understand what it takes to differentiate between mental health and really a person that is doing harm to the community, right? So there is what Councilman Goncalves said, like the pharmaceuticals are certainly responsible for a lot of things, but also the investments that we need to do in organizations that really bring education, awareness, and a holistic approach of resources is really what we need to start doing. So I am very proud to have Program Weber Revenue in the city of Pawtucket, for example. And one of the things that I do feel that the organization does very well, and I've seen them work, is that not only they get hand-in-hand support, but also connect with resources for career readiness, job opportunities, investments into, like, being reinstated in the community when they are coming out of jail, maybe because they were criminalized for, some charges in the past because they were selling marijuana, because of some issues that they had. So I'm very proud to have been part of, the legislators and the main sponsor, and I see it here, of also creating the 9AA line crisis, right? And that comes from the federal level and it trickles down to the state level. Why is that important? Because organizations that bring those resources to members of the community that are suffering of mental health have professionals that are ready to speak with them 24/7. And these professionals de-escalate the way that, these individuals are feeling. I have a family member that goes through, a lot of challenges. And you know how he got into being a little bit of, dependent of opiates was because he got into an accident and he had a pain that is very chronic. And the only way that he could relieve that pain is through opiates. And then so how a person that don't really understand what the journey of that like in this case, my cousin goes through, is going to be judgmental. So we need to really look at these cases in a way that is personal, but we also, as policymakers, really need to look at the holistic way on only doing investments to connect all the dots for all of the individuals like my cousin that go through these issues to be and have second chances in life, opportunities and people that really guide them so they could succeed. So for me, it's about education, engagement, a holistic approach, and organizations such as Project Renew or this organization here to make sure that we do the work together. But it takes a lot of us to create those investments and policy that work for people, and especially when we know that is something that you cannot really control. I see my cousin suffering, and I understand that he needs help. And then that is why, like, having that opportunity to connect with the people itself, then you have a different perspective and you could do policies that work for everyone.
Thank you very much. First of all, I should have introduced myself when I sat down. My name is Don Carlson. I'm one of the candidates for Congress. And my two saw, is that better? I'm Don Carlson. I'm one of the candidates for Congress. I apologize for being so late. It was on my schedule for 6, and I thought I was getting here early, but I wasn't. So I apologize very much. This issue is so important, and I don't mean in any way to give it short shrift. So I really want to say I wish I had been here on time and wish we had given full attention to it. I also am here to learn, and I think I just learned a lot from you about your cousin's experience. And I think there's a lot of wisdom from our collective life experience among the 5 people up here that everybody in our society has had some interaction with drugs in some way, some person in their life that was addicted, had to go through the process of recovery, and I think we've all been touched by that. So I feel like our society today is a lot more compassionate than it was 20, 30 years ago about people who go through the process of addiction and recovery. I had someone in my own life, a very, very close family member of mine, who wound up going into treatment into a rehab center. And when I wound up going down to the Meadows in Arizona and spending a family week down there, I think I learned more about myself and about life and about the power of guilt and shame to destroy people's lives in that week than all the other weeks of my life combined. It was an incredibly powerful experience to be with people who had gone through that experience and who were on their way to recovery, sometimes a bumpy path to recovery, sometimes a non-successful path to recovery. But the wisdom that comes from that suffering is really profound. And so I feel like the people in this room probably have a lot to share in terms of that wisdom, and I'm eager to listen to it. But what I want to double underscore is that it doesn't make sense to criminalize addiction. Addiction is a medical condition. It needs to be treated as a medical condition. I believe me, learned that the hard way with my loved one. And the idea that would be treated as a crime seems insane to me. So I think we've come a long way on that. And I think there's a higher level of awareness than there used to be about that. People are far less judgmental of addiction and see it much more as a mental health issue or just sometimes even a physiological issue like the addiction to opioids that derives from pain and use of the opioids in pain management.
I just want to affirm what's been shared, and I really appreciate you sharing that and all the stories that we're hearing, and certainly would love to continue to glean from the expertise of the people in this room, because you all are dealing with this in a very nuanced way every single day. You know, I was having conversations when I walked in with folks who are in the community who are doing this work, and what you see and how you're helping assist people every single day. This is going to be a little unorthodox, but I just want to give each and every one here a round of applause for all the work that you do. So, and the other thing that I just want to share is we have to be looking at the root underlying causes here. And equity has to be at the forefront of all the decisions that we make. Growing up in the city of Providence, you know, I went to Providence Public Schools, and I was someone who, you know, grew up in a family that suffered from poverty, that suffered from food insecurity. And I think this is something that we need to really, really address is the vast income inequality, because what it results in is, you know, the trauma that kids are experiencing in our schools. You know, I've served as an elementary school teacher for nearly the last decade, and just thinking about what our our kids experience on a day-to-day basis, particularly kids who are different. Kids who identify as maybe LGBTQIA, when we're seeing Republicans double down on the attacks of certain communities. We're seeing the recent Supreme Court rulings, for example. And that is really affecting our psyche. And it's, in many cases, it's resulting in some of these public health challenges and mental health challenges that we're experiencing as a society. But I would also say, you know, I know a constituent who lives on $25 a month. And there are so many people like that who are in our community, and, you know, this person gets shelf-stable, government-funded food, and we need to be thinking holistically about how we even address things like that. Because if we're not providing people with the best high quality, whether it's natural, organic foods, we're just perpetuating this system that in many cases is a sick care system as opposed to a healthcare system. And I just think that we have to do everything that we can to, again, educate, but to also provide people with the resources so that they live a healthy and a natural life, and they're using natural mechanisms as opposed to some of the synthetic drugs out there that are really harming our community. And the last thing I just want to share really briefly is I've heard the word disorder used quite a lot. And I think our language is so important. We have to normalize these things. And when we use language like disorder, for example, I think that also is a barrier and a hindrance to the work that we need to do, specifically on educating folks in the community, but also addressing the challenges that we're experiencing as a society. So I just wanted to share that.
Is it on now? Okay. Let's make a fun scenario. And today was a special election, and you won. And my name is Akeem Jeffries, and I give you a phone call. And I tell you that you're about to go inside the Beltway to a lion's den. And I will give you your choice to be ranking member on any congressional committee, provided you tell me what your first legislative proposal will be. What is that committee and that proposal, and why?
So, I have been vocal about my desire to join the Transportation Committee, and it's because it's connected to the work that I've been doing at the local level, local government. I have seen the challenges that we have in infrastructure, but also I have seen the need to have a better transportation system that is more consistent with the need of the communities that I have represented. Right now, the transportation that we have is not the best way to support the needs of the community. So I will say, if the speaker asks me which committee, and I know that of all of us here, we're running on a special election. So
the speaker or majority leader?
I'm sorry. Well, I was thinking about once the Democrats win the House, right? And we have Speaker Jeffrey, so maybe I'm dreaming a little bit more, right? But I will just ask for transportation. I think transportation has a big impact in our community. And what I was saying earlier is running a special election, there are not many committees assignment left, right? So it would be something for the next election of 2024.
So
Thank you for that question. Naturally, I would go into the Education and Labor and Workforce Committee. I didn't get to tell you, I started my public service role in the school committee in Pawtucket. I went to the city council. Now I'm a state senator, and I'm the chair of the Senate Education Committee. So I've done a lot of work in the education policy because I believe that education is an equalizer. So that being said, that's why I'm picking that committee, if that is my choice. Labor and education goes hand in hand, like I mentioned before. I do believe that my first piece of legislation would be to bring to Rhode Island money that we already been working at the state level, that we haven't gotten state money to really get resources into our school districts. For example, I've been working extremely hard as a chair of the Education Committee in bringing mental health professionals in our schools. And I have done a lot of work with my colleagues where I passed the trauma-informed schools in Rhode Island, so professionals are getting trained, but there is no budget for that training. So at the federal level, we need to do investments to do that training, just like we have the 9 line crisis, that is my legislation as well. I believe that we need to make sure that we not only create pathways to have more social workers and psychologists in the schools that work together with the staff, with the teachers and the students and families, especially after the pandemic. And I think those investments need to happen right now. We are really seeing the increase. We knew this was an issue pre-pandemic, but we're seeing the incidence and the families really suffering, and they don't know where to go to. So the schools should be a place where the kids and families should find that opportunity to get some support. So that investment through mental health, through social workers, psychologists, and Medicaid and Medicare reimbursements, so the psychologists and the schools could reimburse like some money to the federal government, so those funds come right into our system.
So I'll answer that question very directly, and I just want to say that, you know, being a two-term city councilman in the city of Providence and representing one of the fastest growing wards, well, actually the fastest growing ward in the city, but also in the state. I represent Fox Point, Wayland, College Hill, the Jewelry District, and downtown. Budgets are the moral document. So appropriations, if I could have a magic wand, I mean, if you are part of dispersing federal monies to different programs, you have certainly a lot of leverage. But being the 435th member of Congress, that's a pipe dream, especially in a House that's led by Republicans. But I would also say Medicare for all. If we start there, I think that would do a tremendous service on the people that we represent all across our country. And, you know, I'm just going to take an opportunity to throw in some other pieces of legislation that I think are critically important and also tied into this. But, you know, the American housing, yes. Well, I did mention appropriations. As an educator,
I just want to clarify, this was a hypothetical.
Yes,
so.
Yeah.
So I'm telling you, Mr. Jeffries, you are going to get the committee you want.
Yes. Well, so appropriations, right? So, but also education and labor workforce is like my colleague. And then in terms of other legislation, so if Hakeem Jeffries said, nope, you can't have Medicare for all, I would say the American Housing and Economic Mobility Act, and also the Green New Deal. We need the most aggressive climate justice legislation, and if we don't address the existential crisis that is our climate, we will cease to exist as a species. So I think that's a very important one that we need to address head on.
Sorry for the long-winded answer, but you left it open-ended. So.
I just enjoyed sitting here like fantasizing about it. I think it was a great question. I felt like a guy who was like at the buffet, and there's like lobster there and strawberry shortcake over there. It's like all of the goodies. But fortunately, my colleague Sandra Cano is already taking care of education, which is the most important thing. So I get to not have the strawberry shortcake and go for something else, because I would actually go for the Ways and Means Committee, which is one nobody talks about, but that's what writes all the tax policy. So they regulate and decide how the government takes money in. And I think the most important thing that we need to solve after we solve education really is to think about the wealth inequality in this country, income and wealth inequality, because it's hindering our economy. There have been times in our history when we had much more even distribution of income and wealth. Thinking of the 50s and 60s, when our tax rates were much fairer and there was less of a gap between the very rich and the very poor. And that's when we grow the fastest, because people have money in their pockets to spend, to put food on the table, to put clothes on their children, to buy decent shelter, to have health care. And that's when our economy not just grows the fastest, but is growing in the most fair way, because our economy is churning out the things that regular people need. So fewer luxury yachts and fur coats and Rolexes, and more textbooks and winter coats and boots and all the things that families need to raise their children. So I would say that making our tax policy more fair, probably having a wealth tax, so that the very, very rich can't hoard all the assets forever and live off those assets forever, and spreading that out better across our society would be the most important thing I'd like to accomplish. The famous English lord who once said, "Wealth is like manure. It's only good if it be spread." Right? If it sits in a big toxic pile, it just gets toxic, more toxic and poisonous, actually. If you spread it on the field, the crops grow and the flowers bloom. So what you really want to do is spread wealth around, and it makes our economy run better.
We should also apply to our politics. We need to end systems united once and for all, because there's big money in politics, and I think that results in a very unequal level playing field when it comes to what we're doing in this race. And so I wanted to say that too.
Being the last sometimes is not the best thing. But one of the things I would say education. I remember when I went to a meeting with the Senate President when I won my seat, and she asked me, "What committee do you would like to be?" And I said education. Education, because that's the one who opened the door to our children, and I think we felt our children for years in Rhode Island, having the worst education department, the worst education in many other ways. And we've done a lot of progress. We work a lot to do so many things, but one of the things that I always said, that Rhode Island copy a lot of things from Massachusetts, but one of the things that we decided not to copy is to make education a constitutional right for children in Rhode Island, and I think we need to change that. Another thing that I would love to be, I always had so many legislation for criminal justice, and that's being my main issue if I get to Washington, when I get to Washington, because I think we need to make, especially people of color who get paid, you committed a minimum crime, and they give you years when somebody else made the same crime, but it's not justice for all, like we said it is. Then for me, I'm part of the Judiciary Committee here in Rhode Island, and I would love to be part of the Judiciary Committee in Washington, because that's when you make a lot of those decisions to be able to pass, like the legal board. That's one of my legislation, life without parole. If a kid made a crime before they're 18 years old, to have the opportunity after 15 years to go in front of the board. And this is a many legislation that I have here in Rhode Island now, that I've been working on those from day one. It's very easy for a lot of people now to say, I will do this, I will do that. But my progress is that I've done it, I'm doing it, and I will continue to do it. Because it's easy to come here and say, oh, if I get to Congress, I will do this, I will do that. Look at my record, it's talk by itself, I will do this, and I promise you that this is one of my hard things that I worked for many years. For the last 7 years that I've been in the Senate, I've been working on criminal justice, and I will continue that work in Washington.
Hello, can you hear me? Hi, good evening. So my name's Roxanne, and you know, I have been around in this environment for a long time, and I've heard a lot of great things from people, and a lot of I've heard a lot. Let's just say that I was an active addict for 10 years. I've been in recovery for 11. I'm a recovery research scientist now. I have a clinical background. I have a lot of moving parts. I know a lot of people. And so what I hear a lot is this misunderstanding of what addiction and recovery is. It's very little to do with any type of substance. These are just the most obvious symptoms of what is going on. And we tend to view recovery in terms of the immediates. They're not using, so they're okay. The reality is that clinically, someone is not considered stable to about a year. Research has identified different phases of recovery. With about 3 years, you become sustained. At 5 years, the statistical likelihood of you developing another substance use disorder drops to that of the general public. So a lot happens between active use and becoming to that stable point. We don't normally tell people that when they first get into it. We don't want to scare them, right? So we have this continuum of care that has major gaps in it. Somebody visits the Harm Reduction Center. On that particular day, they just decide, like I did, I just don't want to do this anymore. I want to get help. They call, there's no beds. Might as well just continue using. Or how about they make it to the treatment facility, insurance runs out. You gotta go. Or they go home and then their kids are nagging them. And they haven't been a parent in 5 years, so they have to go to even worse, DCYF. So what are your plans to address the continuum of care so that not only do people find recovery and initiate recovery, they sustain it?
So Roxanne, I like your passion and always have admired your work and advocacy in the community. So I personally know Roxanne for a long time. This is what I would say. It takes people like you to do the organizing with people like us to make sure that we bring those voices to the State House or to Congress in order for legislators to really understand the real impact. I've been around for a long time as a legislator and at the local level, but also at the state level. And what I tell you, the most success that we do have in passing legislation is when the community really do organizing, bring strategies with the sponsor of the legislators, and then find strategic answers to the problem. In this case, I believe that the first thing that I would do is advocate for sustainable resources that are not going to go away. So that we have a line item in the budget that really goes to the services that you just were speaking about. Because at the end of the day, I think as a member of the Finance Committee, I have seen that the way to do this, and I'll tell you a story, is if we show with data and with testimony that we being proactive is going to be more cost benefit for the state than being reactive, those investments are going to make sense for legislators, because I'll be honest, sometimes money is what the issue is. Not so much the problem, is the money, right? So I'll tell you a story that is a real story. Just last year, we passed at the General Assembly, and it was my legislation, and Representative Morales covered all kids. We wanted to reinstate and make sure that Medicaid covered health insurance for every kid, regardless of the immigration status, regardless of low socioeconomic, background. So long story short, the way that we were able to do that is with that data, that it cost $3 million to cover the kids, but it was costing $12 million. The state, when they would go to the emergency room, and the state would have to cover that up. So doesn't it make sense? So I think that my plan would be just that. Learn with data, with advocates, how much it costs, what is the resources that it takes to get the services that are like needed, and be proactive instead of being reactive. So as a legislator, I plan to do that. I will be a person that is open and transparent to learn and to work with community members like yourself to know what it takes and have a plan and a strategy together. So that is what I will be doing, and thank you for your work, Roxanne, and everybody, and your passion is really amazing, so thank you.
Roxanne, that was just such a poignant question. Thank you for bringing that to the fore. I would say, like my colleague here, that was beautifully articulated. You know, I've been the lead sponsor on dozens and dozens of pieces of legislation at the local level. And the kinds of legislation that, in my opinion, have been the most effective are pieces of legislation where it's truly a grassroots effort. It's a bottom-up approach as opposed to a top-down approach of governing. And when we listen to the stories, the nuances and the challenges, and to your point, the lack of continuum of care, that's when people kind of fall through the cracks. And so having a very data-driven approach, but also listening to the real stories. And I think that is so important here. There's a lot of people who talk about theory, but the practical reality on the ground, when you talk to people who have actually undergone some of these situations, that just simply cannot be replicated. And so it is incumbent on us as elected leaders not to pretend that we have all the answers, but to center the communities in every single decision that we're making and make sure that the community is involved in the legislative process, that people aren't falling through the cracks, and so that it's really nuanced and targeted and pointed and specific to address the challenges that people are facing out there. And to my colleague's point, when you do that, it actually leads to much better legislation that's reflective of the needs on the ground. And this work isn't theoretical. And I think that's, you know, I applaud the actual legislators on this stage because, you know, there's a lot of people who use all the right talking points. They say all the right things, but, you know, have you actually dealt with these things as a legislator in your own personal life? Is a privileged person, for example. There's a lot of privilege out there. And I would venture to say that those of us who have that lived experience of knowing what it feels like, having community members who go through that in a very nuanced way, again, it just can't be replicated. So I really appreciate that question and just want to say thank you for bringing that up.
Thank you, Roseanne. I think what you explained happening with the continuum here is another example of what I mentioned earlier of the problem with the definition of homelessness. Because someone in that situation, we should be able to have resources at the local level to assist them to find a place where they can stay. And as long as we have this definition of homelessness that doesn't prioritize individuals that doesn't have a place to go in a situation like that, it's gonna make it harder for someone to get into recovery and be able to get their life in a different path. So I just, as you were speaking, I just thought another example of how the definition of homelessness needs to be addressed.
Well, for me, I really think it's insurance. We have to make sure that everybody has a great insurance. Because for you to be able to get into the right place, you have to have a good insurance. So your insurance is not good, they're not going to take you in. If they take you in, they're only going to give you 1 night or 2 nights, not enough time for you to be able to get the treatment that you need. Then the first thing is to get Medicaid for all. That everybody have the same insurance. That my insurance have to be better than yours, that yours have to be better than mine. And see, we work on that. We can guarantee that we will get more beds to people who need a treatment, that we will be able to, anybody go to any facility, because all depends how rich you are or how poor you are for get the treatment that you need. If you are rich, you're going to be able to pay for that treatment, but when you don't have the money and you don't have the insurance, you're not going to get the program that you need for that issue. Then I think that's one of the biggest problems that we face today. Depending your insurance, depending the treatment that you're going to be able to get for your problem. Then see, we fix Medicaid for all, and everybody has the same insurance, we're going to be able to cover that issue very easy. We need to bring the resources to the state to make sure that we have more available beds when somebody needs them, because so many parents have to go out of state to be able to bring their children to a treatment, because we don't have that in Rhode Island. We don't have the treatment that those children need. We don't have enough bed or enough program for everybody to be able to get the treatment that they deserve. Then that's will be the first thing that we need to do. Thank you.
I think Senator Casada, I think Senator Casada nailed it with the issue of insurance, Roxanne. I think, you know, the two mental health crises that I've encountered in my lived experience with people that I was responsible for, we were fortunate to have insurance. It was a close call because the Affordable Care Act, you know, sponsored by President Obama in 2010, saved our bacon the first time around, because that put in minimum standards in health insurance so that people could get the care that they really need on a sustained basis. And I think this is an example where legislation really can make the market work better. And the Affordable Care Act put minimum standards across the board for all the different insurance policies, so that people who do have health insurance, who are lucky enough or privileged enough to have it, can actually get that sustained continuum of care, provided to have good doctors who authorize it for them, and good counselors like you who can prescribe it for them, and help them understand that they need it. So that's that minimum floor that's really important in legislation. That doesn't help the people who don't have insurance, or the people who have inadequate insurance that's either illegal or it's government funded that doesn't quite cover all that they need. So I agree completely that we need more resources devoted to it. And I think this is one where we have to put in minimum standards across the board so that whatever insurance plans we have, whether we're going to go for Medicare for all, which is a great idea, or whether we're going to stick with private insurance, that we have minimum thresholds. Because even when you can see the path that says that the $3 million is a lot cheaper than the $12 million, as Senator Cano said, and it's smarter to spend the money now than to spend it later, that doesn't always happen. Because sometimes one insurance company wants to save the money today, they think another insurance company will need to be on the hook in the future. So it's not a system in which rational choice dominates. And so I think having those minimum standards is really important, and they should be built to provide that continuum of care.
Hi, my name's Lori Dorsey, and I've been in recovery for 35 years. Okay. It really like fooled me. All right.
Me too.
I've been in recovery for 35 years, and I went through treatment in Rhode Island, worked my way up, a very long, involved story on how I came to be where I got, but I wound up at VHDDH, working to oversee the treatment programs. And I'm not sure that you understand how it works here. It's a little different. We're backwards. People here get longer time in residential treatment with Medicaid than they do with commercial insurance, and that's why a lot of people go out of state. Commercial insurance in Rhode Island does not cover much, and I'm not sure what the reason is. It may be the condition of some of our programs that really need to be rehabilitated themselves, the buildings. They're not very attractive. It's almost impossible to get in on demand, and you know addiction, you know people need to, we always say, you got to get them while they're hot, because they're going to change their mind in a minute. Yeah, it's a very, very tough disease to fight, but it can be done. I myself lost my son to addiction a few years ago, and he worked in a treatment program. Now, he was in recovery, he was going to AA and NA every single day. He was at our house all the time. He and I were at a 12-step convention together that weekend, the weekend before, and I did not know he was using. And the point that and neither did the treatment program he was working for. So the point I want to make is this can happen to anyone at any time. The person next to you could be using. You don't always know. You know, once you have a tolerance. It can happen to anybody, but I want to tell you that our system is very heavily managed by BH-Link. And SAMHSA, who we get our funding from, does have a designated priority list. So pregnant women have to go in first. You know, it's tough. There's a whole priority list the way that it has to go by law. And a lot of people just can't get in. We don't have enough beds. I don't know. We can hear you. I'm giving up. I do. It's the most frustrating thing I've ever seen in my life, trying to help an addict get in, and they can't. And the beds are very heavily managed. I just wanted to make that point, so that those priorities go in first. People have to wait when they're in treatment. They don't know when they're going home. They can get a message the day before you're out of here. So while they're in treatment, they're not focusing on treatment. They're focusing on, like you said, housing. How are they going to live when they get home? It happens to people with houses too, you know, and they really don't know what is going to happen because it's done day by day with insurance, where the counselors have to call up and get authorization every couple of days. So how can you focus on what you're learning? So there's something wrong with the entire system as far as that goes. And, you know, in Rhode Island, we have we don't have a dedicated fund. Everything goes into the general fund. So I don't know why I'm holding this up to my but with that, you know, the DUI money doesn't go to VHGDH for that. The harm reduction money that everybody seems to be getting isn't going to go to VHGDH for that. It's going into the general fund, and VHGDH doesn't do it. So I just want to make that point that, you know, it's a big, wide system problem that is so big with the way that we're running things. And people are dying like I've never seen them. We are doing something wrong. There's no beds. There are never enough beds. For detox even, you can't even get into a hospital. All this got them on cots in a waiting room for days. Don't you think they're going to get up and walk out when they feel better? They're not going to sit there and wait and go to residential. It's a nightmare what's happening. And it's all Medicaid. There's not enough money for Medicaid to pay for anything that is going to be a livable wage.
And I just want to say, and I'm sure everyone here would agree with this, it requires leadership. There are so many people who turn a blind eye to these issues, and in order for us to address it, we have to lead. And I'm sure, you know, you've been there a million times where you're like, why does the system not work? And I think it's much in part due to the lack of leadership.
What do you perspective? This works.
I happen to be the mother of a son that 3 weeks ago overdosed. And he had to be knocked home 4 times and then given CPR. I went to the hospital. We got there at 6 o'clock, and at 10 o'clock he woke up because he was okay. To me, addiction is the same as it is under the umbrella of mental health. It has to be, because when somebody's brain is that absorbed, how can they think rationally? How can they possibly make any kind of normal decision, have a normal reaction? Their brain is literally hijacked by the drugs. These fentanyl, heroin, cocaine, xylitol, whatever is out there, he was taking. And he was on a waiting list to go in to rehab when this happened. And now he's been out for 3 weeks, and now he's trying again. No beds. Roger Williams, no beds. There's no Medicaid beds in certain places. And he is on Good Health, which is a great program for addiction, but because I guess obviously I'm only speaking as a mom. I know very little other than that this has happened to me. And I don't speak about anything that I don't know or something about. And for me, it's a form of suicide. And I don't think, if somebody called you and said, I'm going to jump off the Newport Bridge, would you say to them, I'm sorry, we can't help you right now. Can you call us back tomorrow? He was told to call every day to see if there was a bed. He wasn't getting up until 12 or 1 o'clock at night in the morning because he was like using all the time. And it's a nightmare for a family. It's a nightmare for a parent. I mean, it's not something, he's been using for 20 years, but the progression that this is taking and the drugs that are out there, they're meant to kill people. That's what they're meant to do. And unfortunately, he doesn't understand it. He might want to understand it. He can't comprehend it. But for 2 hours in that hospital, I didn't know if he was alive or dead. And no parent should have to go through that. And I came here tonight because I just feel so strongly that there needs to be so much more help for these addicts. My son wasn't born wanting to be an addict. I had an older son who was an addict and who also had a mental health disease. Once the mental health disease was addressed, the addiction went away. Because he was covering up with the meds. And this may be the case with this son too, I don't know, but nobody's really doing anything. And I'm not saying that he's been very compliant at times, because obviously he's not going to be, because there are times that he wants to get well, and Lori just said, if you don't grab them at that moment when they say, I need help, next day they're going to say, no, I don't need help, I'm fine. So it has to be immediate. And I know that's an impossibility, but I would love to know what you can do once you become Congressman, what you would do to help addicts. Because they're not all homeless. They're not all homeless. And they're not all uneducated. And so it can, as it said, it has no boundaries. None whatsoever. So we need more detox. We need more beds. We need more staff. We need everything to help everybody as much as we possibly can. We're not going to be able to save everybody. I understand that, but I think doing the right things can help. So I would love to know how you feel about that.
Well, it's very sorry to hear a story and to see you as a mother. I can understand you if I have 3 children and imagine what you go through. But at the same time, go to the beginning, I said we need to bring more resources. I have MAP in my community, and a few months ago I got a phone call from them because they were closing them because the heat wasn't working for them. And I did everything possible to make sure that 102 bed in Rhode Island cannot be closed. I went myself to the department, I talked to the director, I made sure somebody came and see the problem that MAP was having with the boiler. I did everything I was able in my power to do because I know how important it is to have bed available for people who are going through overdose. And I can say that because I've been working on this issue for many years. Like I said, I'm the only one who had on the west side talking about overdose. So I check everybody's website and no one talking about that. I'm the only one from day one. I think it's a crisis and we have to do something. I think we need to bring more resources to the state. I think we need to bring more awareness to people because we don't talk about that. It's a secret. We don't talk about overdose. And like I said, it killed more people than guns and everything combined together is overdose. But people not talking about it. And I think it's a main issue that we need to talk about it. We need to bring that issue. We need to do something ASAP. It's not something we can wait. Our children are dying. And if we don't do this now, we're going to have more problems in the future. And I can guarantee you that that's something that I will make sure as soon as I get to Congress to bring the resources that Rhode Island needs for a family like yours don't have to go through that again. Thank you for having me here today. It's been great to have this opportunity to talk to each one of you and to learn. Because like we said, we are learning from you. And, you know, and you are the expert. You are the people who are advocating for this issue. We need to hear from you what you think is need to be done, and we need to be open to your, you know, because you have the solution. You do with this issue every single day. We don't do it. We only do legislation, and promise you that that's what I will work hard, like I've been done it for the since I've been in the Senate. This is an issue that I've been working on. Thank you.
Thank you. Thank you for sharing your story. And I agree, just as the Senator said, we need more resources. And I'm committed to working to make sure that we bring as many resources as we can to Rhode Island in order to address the challenges that our community is dealing with mental health, with substance use. And thank you for your feedback in what you said is very important. Not everyone that is having substance use is homeless. So thank you for saying that, because it's very important for us to remember that. Thank you. Again, I just want to thank all of you for your feedback. The main reason why I was here is because I wanted to learn and hear from you. And my approach in public service since I have been in the local government has been that. I always say, I know that I don't have all the answers. I know that I don't know everything. But my approach to public service has been to know where to go to find the answer and where to go to. The number one thing is you have to admit when you don't know something and make sure that you're willing to go and find the right resources to get that information. And when it comes to this space, I hope I can count on your support and your feedback always in order to represent the people of Rhode Island well. Thank you.
I just want to thank you for having the courage to share your story. And I just can't thank you enough just for being open, honest, and authentic. And I know we're pretty far away, so I'm just going to give you an air hug, if you don't mind. And I mean, so many people like yourself are dealing with these issues. And it requires real leadership, people who are going to center the voices of the people who are dealing with these challenges every single day. And one of the mantras that I live by is the people who are closest to the problems are closest to the solutions. It's no different in this case. And what I want to say is, if you elect me to be your next member of Congress, the work that I've done at the local level, and you know, I'm gonna say, Senator, we've got a lot of stuff on our website too, a real track record of getting results. You can ask my constituents on the East Side. I'm effective, I'm reliable, and I'm incredibly responsive. It's my reputation. And I promise you that we will do everything in our power to exercise leadership. It's exactly what I've done at the local level, bringing millions and millions of dollars to whether it's organizations or community centers in my immediate neighborhood, in the fastest growing ward, not only in the city of Providence, but in the state. And And that's the kind of leadership that I'm going to exhibit at the federal level. And again, I just want to thank you all for your engagement today. I want to thank you all for being open, sharing your stories, and I just encourage you to check out our website, John G. for Congress. We have a very robust policy platform, and I would love to work in partnership with you on addressing the issues that each and every one of us care about. So thank you for being here.
Thank you so much for sharing this story. It is, as a mom, like certainly your words resonate with me of no mom or no family should go through like what you've been, and especially it is this heartache that a lot of people that probably goes through the same experience that you do, that don't have the opportunity to lift up the voice and let legislators know about this experience, that it's real, that it's happening, that it's affecting our members of the community. And we, at least as a legislator, I would say, we need to do better. I'm currently a state senator, and I would say that, yes, we've done some progress, but for no reason we shouldn't be in a state where we are not prioritizing saving lives. That for me is really the issue here. Like, you know, we are not saving lives, and that is a problem. That being said, there is an issue that I would like to mention as a state legislator, as a city council, as a school committee member. One of the main problems that I see in government is that we don't talk to each other about the solutions. We make it so difficult. We don't talk to each other. We, like, you know, put more hurdles into making policy work for people, and that should stop. So if elected to Congress, one of the things that I would love to do is bring the voices of the community, because I'm one community member that is involved in the community and for the community. That has been something that I'm, like, you know, always have pride on. I love to continue having that advocacy at the federal level, but with the voices centered in the people that really know what it takes to make a difference. So I cannot do this work alone, and that for sure would be my message to you. I think that this work needs to be collective work. I will be honored to have the voice that you need and lift up that advocacy and that effective leadership in Congress, like I've done here at the state level. But we need to start by talking to each other. And we have a very divisive country right now, and it takes someone that has the right attitude to make a difference. So yes, resources, I mentioned, is important. Having the understanding of how legislative work is a priority, and being able to have the passion to advocate for your issues is certainly what is going to make a difference. And I hope you consider me. I'm Sandra Cano. I'm running for Congress, and it's going to take one of us to make a difference for all of us, and I hope you consider me September 5th. Thank you so much for the opportunity today.
And I think all of us thank you for sharing your story. I could hear the pain in your voice and in your face, and as a parent of 3 adult children, I know how hard it is when they're out there in the world and they're struggling, and there's nothing you can do to help, or you feel so helpless. So really, they say you're only as happy as your unhappiest child. You don't go that way. Yeah, so I do think a lot about overdoses. I'm a volunteer EMT, so I think about it every day. And, you know, when you see Narcan administered, it's a pretty dramatic thing. But it is the quintessential mandate. As you said, your son was Narcan 4 times that night because it only lasts for 15 minutes or so. I wish everybody knew that, by the way. If you ever need to administer Narcan, I carry some in my car all the time, just in case. If you ever need to administer it, you got to do it like every 15 minutes. You can't, like, rest. And then you got to get that person to the hospital. So just, if you ever do administer it, please, experience situations where people went to sleep after having the Narcan and then they died. So, you know, good idea to make sure you keep administering it. And this is a situation, I think Senator Cano put it really well, these are lives at stake. You know, and if this was a little girl down the well, or this was some kids, a soccer team caught in a cave, you know, we would expend all kinds of resources to save these lives. So why don't we think about it the same way? And as you put it, if somebody up on a bridge who's ready to jump, you know, why don't we think about it the same way with the same level of urgency? And I think it goes to our attitudes about mental health. I've had a lot of long talks with Kathy Kennedy, who used to have the office we're running for. Some of us are old enough to remember. And he, and you know, Patrick brought a lot of attention to that issue because he struggled so much, and his family struggled so much with mental health. And so his big thing was always like, just go to mental health. It'll always be the right answer. It'll always be the thing you want to work on. It'll always pay dividends. And that was the advice he gave me running this race. And I think maybe that's where we should be focusing, because addiction is not always a cause, a thing by itself. It often is the result of a deeper mental health issue, as many people in this room have alluded to. And I think we're going to look back on this time right now as the dark ages of mental health, about how little we understand about the brain, how it functions, how mental health operates, and the ways in which we can treat it, and we can go through therapy as well as through medication, bring us to a different place. So I think the investment in mental health is something that I want to work on very acutely and very deeply as a Congressman.
Thank you so much. I really appreciate all of the candidates' time getting here for whatever time you were able, and I know you're balancing a number of commitments, so it's really meaningful to me and I think to this group that you made the space to be with us today. I appreciate the audience's feedback and questions, great questions. If you are interested in making sure that whoever ends up there on Capitol Hill for us is accountable to what they've said today, I encourage you to join NADAP. We have a very strong public policy committee for addiction professionals. Same for motion and entrance. And again, thank you, and be safe and be well and take care of each other.